Hi, everybody. Welcome to MedPsych Health. I have Dr. Mark Sykes with me again today. Dr. Sykes specializes in treating anxiety. And as we're recording this, we're in the midst of the quarantine from COVID. And Dr. Sykes, I'm curious, what are you seeing in terms of, as someone who specializes in working with patients who struggle with anxiety, what are you seeing? Who's struggling, who's not, and why? Can I share some of those insights with us?
Absolutely. I think the people that are doing the best or are coping, or in some cases even growing, are the people that are really actively using coping skills that they've either learned in treatment or they've just learned throughout their life, help them manage their anxiety. So people who are taking the time to practice things like relaxation techniques, whether that's breathing technique, meditation, people who are taking the time to really structure their day and make sure there's balance, that they're exercising, and people that are in contact with their social network on a consistent basis are doing well. I'm also noticing that people who are actively engaging in things that give them a sense of meaning and purpose tend to be coping quite well. The people that I tend to see struggling the most and are having either an increased anxiety and in some cases an increase or an instance of depression are people that are hooked on the news the most. Yeah. People who are spending the most time watching the news or on social media tend to be struggling. And for people that are struggling with that, I highly recommend they regulate the amount of media contact they have right now. Now, I would say they regulate the amount of contact about COVID-related news, but if you turn on the news, you're going to hear something COVID-related.
Honestly, it's impossible. I've had patients tell me that kids, they're so sick and tired of hearing about COVID. They are so done. So, that makes perfect sense. Yep.
Yeah. But some people are they're hooked in it. It's almost like they're just not even realizing that they have an option not to watch. And some advice I'm giving people who are struggling with anxiety with news is make sure that what you're watching is actionable. So is what you're watching something that can affect your behavior right away to help you reduce the transmission of a virus? And if it's not something you can change, turn it off, because what's happening is people are re-triggering themselves. Another group of people that I see that are struggling with a lot of anxiety are people who aren't creating any structure for themselves throughout the day. Yeah. And especially people that are just engaging a lot of passive activity. Now, to a certain degree, we all need to give ourselves a little bit of a break right now and not be kind of so perfectionistic. However, if someone's really spending extended periods of the day, binge watching Netflix, Hulu, shows, video games, while temporarily, when someone's engaged in that activity, they may not be as anxious. As soon as they step out of that, their anxiety seems even more unmanageable, and then they feel compelled to go back to those things.
Well said. Thank you for those tips. Hope that's helpful for those of you who are watching.